hip precautions. I'm going to go through these slides and then I'm going to demonstrate with a regular chair what some of these hip precautions are. So in this picture, we do not want you to cross your legs. And a lot of patients will say, well, Betty, I haven't been able to cross my legs at the knees for years, so I don't have to worry about that hip precaution. Truth be told, many of you cross at the ankles. Start paying attention because you don't realize how often you do it. And I encourage you to start breaking that habit of crossing your legs. Start working on it now. It'll be one less thing for you to worry about later on. The next one is we want you to keep your toes straight ahead. And the very first time I said this to one of my patients, he says, Betty, my feet aren't on backwards. Of course, my toes are straight ahead. But the reason for this is depending on the type of your surgery. If you've had, and this is only obviously for the hip patients, the knee patients don't have precautions. But for a hip, if you have what's called a posterior lateral incision, the doctor doesn't want you to turn your toes in. If you have an anterior approach, the doctor does not want you to turn your foot out. So to make it easy on everybody, keep your toes straight ahead, okay? And I'll talk a little bit more about another way you can mess this up when you're walking with your walker. The third hip precaution is do not bend past 90 degrees. 90 degrees, I want you to think of the capital letter L. She's breaking hip precautions right here because her knee is much higher than her hip. The capital letter L would actually have her legs going out like this. And this is breaking her hip precautions because she's leaning forward. So we don't want you to lean forward to reach for things or to get up. And that's a big thing because most of us, when we go to get up from a chair, we lean forward. And then this is only for the patients who are having an anterior hip done. We do not want you to take any wide steps back or any wide steps to the side. And that's because that's going to increase the motion where the incision was completed. So now this summarizes everything. So the first one is not to cross your legs at your knees or at your ankles. Keep your toes forward. Do not bend past 90 degrees. That's your capital letter L. And then for the anterior hips, no wide steps to the side, no wide steps backwards. So sitting in this chair, there's a couple of things that are happening. First of all, this chair is appropriate for my height. Secondly, it has arms on that are very helpful to me when I go to get up, and I don't have my ankles crossed. Now, you know not to cross the knees. This is problematic. So what I tell patients is over the next several weeks, you're going to be using a walker or a cane. So whenever you sit down, position the leg of the walker between your feet. Because then if you go to cross, you're going to kick this. It's not going to stop you, but hopefully it will serve as a reminder to you. The next thing is when you are laying in bed, you will have what's called the abductor pillow. And we affectionately call it an A pillow because it is in the shape of an A. And what that does is it will keep your legs spread apart like this when you're in bed. The abductor pillow has Velcro straps on it, so while you're moving around in bed, your leg's not going to come loose. We will talk with you while you're here in the hospital about how to position when you want to rest on your side. And that's something that's kind of complicated, so I'm going to let physical therapy take care of that. Now, the 90-degree angle is that capital letter L. And I said no leaning forward. Most of the time when we go to get up from chairs, what do? One of these. I've now broken my hip precautions. So what I encourage you to do is slide to the edge of the chair, and then you're going to boost off from the arms to get into the standing position. That's how to correctly get up from the chair. Now, the other thing I wanted to mention is when you go to reach for things, if it's past your fingertips, do not lean forward to get it, because leaning forward to get it is going to cause you to bend at your hip, and it will cause you to dislocate. You never want your knees to go higher than your hips, so the chair you sit in must be the appropriate height for you. Right now, this chair is fine for me, but if I was 6'4", my life would be very different. But if I was 6'4", this chair would not be appropriate for me because it would be too low. So what I would need to do is to raise this portion of the chair so when I sit down, my knees are not higher than my hip. And there's a couple of ways you can do that. One of the easiest ways is to just get big folded blankets and put them on the seat of the chair. Obviously, you'd need to cover the entire surface of the chair, and that would give you some height. Another way is to use one of these big hard foam pillows. And they're hard in that they don't sag, but they're not so hard that you feel like you're sitting on a rock. So obviously when you put this in the chair, that's going to give you some height with that. Now, the other type of chair you've got to keep in mind is to make sure that what you sit on is level. If the chair slants back, think of an Adirondack chair. That's an extreme example. But if your chair slopes back like that, and most of the time you're going to encounter that problem in an automobile, what you want to do is get a big thick blanket, and this is a little narrow, but let's say this was for the car. And what you do is you make a very long rectangle. So it would be something like this. And then you start folding it for kind of the depth of your fanny, so that when you put this in the car, you actually have, and I'll turn the chair sideways so you get a slightly better picture. You have this portion which is thicker, this is thinner, and a little bit of hang down. So what this does is it levels the seating portion out. I like to use the analogy, when I lived in my parents' house, the oven was not on a level floor. So whenever we made a 9x13 cake, one end of the cake would come out this high, the other end would come out this high. So to make it look nice, you'd put a little bit of frosting here and a lot of frosting here. Now you got a level cake. And guess what side of the cake went fastest? This side, okay? Now, we talked about keeping your toes straight ahead. And most people, when we walk, do not have any problems with keeping our toes straight ahead. A little bit of turnout I'm not going to worry about. But if you're going like this, or if you're going like this, you're going to get in trouble, okay? So you're walking along, life is good. You go to change directions, and I see people do this a lot before they get instructed. They go like this. Everything is wrong with this, okay? I've twisted my hip, and guess what? I've also rotated my foot. So the correct way when you're changing directions is to take a series of small steps to the side until you're facing the direction you want to go. Okay? And then we talked about no wide steps to the side, like this, and no wide steps backwards, so like this. Do you have to back up? Yep. Just make it a sensible step. Do you have to step to the side? Yes. Just make it a sensible step.